If you've had babies or you're in menopause, there's a very high chance that your core has changed, whether you realise it or not. We're talking about pelvic floor dysfunction and something called Diastasis Recti, and most women are never actually shown how to fix it properly. Today I'm going to speak to you about what's really going on with your pelvic floor and abdominal wall, why traditional exercises can actually make this worse, and the exact exercises you can start doing today, even if you can't lie on the floor. Let's break this down really simply. Your core isn't just your abs, it's a whole system. It includes your diaphragm, your breathing muscle, your deep core muscles, your pelvic floor, and your connective tissue through the midline of your abdomen. What exactly is diastasis recti? This is when the abdominal muscles separate down the middle. It commonly happens during pregnancy when the baby starts to grow, but also because of menopause due to hormonal changes that affect the connective tissues. And what is pelvic floor dysfunction? Your pelvic floor is a group of muscles that support your bladder, your bowel, and your uterus. When it's not functioning well, you might experience leaking, heaviness or pressure, weakness, or even too much tension. And why does this matter? Because if you jump into crunches, planks, or high-impact exercises without support, you can make the separation worse, increase the pressure downward, and worsen your pelvic floor symptoms. So instead, we focus on breath, connection, and controlled strength. So if this has been an issue for you, try some of these really simple exercises that you can do from home to help support your pelvic floor and potentially improve your situation with diastasis recti. Just want to say I'm not a pelvic floor physiotherapist, however I've worked with many women who have had this issue. Here are some simple things you can do from home to help support this situation. The first exercise is called 360 breathing and core connection. It can be done seated or standing, which makes it perfect for everyone. So in a seated position, start by placing one hand on your ribs and one on your lower belly. Take a deep breath in through your nose and feel your ribs expand out to the sides and back. As you exhale slowly through your mouth, gently draw your lower belly in and lift through your pelvic floor like you're stopping wind or stopping pee and lifting internally. No clenching, no sucking in hard. This is your foundation, your core working as a system. Next, we have the standing core brace or the functional core activation. So stand tall with your feet hip width apart, inhale to prepare, then as you exhale, gently engage your core and your pelvic floor. Now hold that connection as you lift one arm and exhale as you lower. So as you inhale, lift your arm over your head and think of lifting through the pelvic floor. And then as you exhale, allow everything to release. You can also do this by lifting one knee, so you incorporate balance. So when you lift the knee, you think about lifting through the pelvic floor. Remember your breathing, your connected breath, and then change sides. It can be very challenging to focus on your breath, your balance, and your core all at once, so it takes a bit of practice. The wall supported squat. Stand with your back against a wall and feet slightly forward. Inhale as you lower into a squat, and then exhale as you stand, gently engaging your core and lifting through your pelvic floor. Think exhale on effort. This helps to manage pressure and protects your abdominal wall. Next, we have heel raises with core control. So stand tall and grounded. Exhale, engage your core, and then slowly lift your heels and lower back down with control. This might look really simple, but it trains your core and your pelvic floor to work together during everyday movements. Here's an optional floor exercise if you can lie down. It's called heel slides. So lie on your back with your knees bent. Exhale and engage your core, and then slowly slide one heel away from you. Keep your pelvis stable and avoid any doming through your stomach. Bring it back in and repeat on the other side. It's much easier to do this without sports footwear. So try it with just wearing socks and lying down on a floor where your socks can slide. Your body hasn't failed you, it's adapted. And with the right approach and patience, you can rebuild your strength, confidence, and function at any age. Start slow and focus on connection over intensity. And if this has helped you, make sure you subscribe because I'm here to help you feel strong again, especially through midlife and beyond.